Hello, everyone. Thank you for joining us for one more very interesting panel discussion powered by Gravitas AI. And today we have a very interesting panel, a very interesting topic. And let me begin with introducing our panelists. So, with us, we have Dr. Karthik. He is the Vice President, Apollo Hospitals, India, and he's going to help us understand the integration between AI and healthcare, and what is the future, what are the hurdles. So we have a very interesting topic in terms of discussing healthcare administration and patient engagement. And of course, our very own Mr. Arsh Srivastav, co-founder Gravitas AI. So with this, Karthik, let me pass the baton to you. It would be great to understand a bit about yourself, how long you've been in this industry, your expertise. It'll be lovely to understand more about you.
Great. So thank you, Sneha. Thank you, Ursh. Thank you, Gravitas AI, for having me over. Once again, glad to be a part of this family and discuss about implications of AI in healthcare. So I'm basically a physician by training, by basic bachelor's training, and I've done my master's in business management. Presently take care of the international business development for Apollo Hospitals. Uh, so broadly, my experience spans across pharmaceuticals, medical technology, and now into healthcare service delivery. And I think in each of these domains, and it's a patient continuum, as you can see. So the patient being in the center of each of the businesses that I have just referred to, and
Hmm.
whether it's medtech, whether it's pharma, whether it's medical healthcare service delivery through hospitals. And at the
Great.
end of the day, all of these are all these businesses are built around patients, who's the consumer of the output or the service or the product that each of these organizations develop and produce. And I think one additional aspect which touches all these three sectors is insurance. And even within insurance, naturally, health insurance or medical insurance, there is a huge play that is possible with AI. And hence,
Correct.
I do see that AI is all encompassing and there are multiple applications that are possible with AI. And so, therefore, very happy to share what we are able to possibly put into practice in the current context and what are the future possibilities that are possible with these applications. Thanks for having me over.
Excellent. Thank you for being here, Dr. Karthik. And Harsh, passing on the baton to you again. How does it feel to be, on a panel? And I think we've already had a very similar panel in Bangalore. So I think it's kind of a bit nostalgic for me as well. How does it feel for you, Harsh?
Yeah, I think it's really great to have the same set of people and discussing something which is very good and interesting in terms of healthcare and artificial intelligence. We did have a very amazing conversation back in Bangalore when we all discuss it together. So I'm really looking forward to having a very amazing session together with Karthik and yourself.
Excellent. So, with the first segment, let's start with discussing the fireside chat, in which, of course, let me bring up the first question, something that is on everybody's mind, but we kind of we're not able to articulate and ask it out to the right person. So, let me put it out to Dr. Karthik. What do you think is the biggest hurdle in terms of this widespread AI adoption that's coming into healthcare administration, maybe in patient engagement? And how might one look at addressing this as well, when they're trying to put themselves in a position of say a patient or a doctor? How do you see it from that perspective?
I think the most important challenge that we face in healthcare administration, and when I say administration, I am looking at it from each type of stakeholder, be it a promoter or a chairperson of a healthcare institution, be it the management, like a chief executive officer or a chief operating officer, the one who runs the day-to-day operations and business of healthcare institution, be it a service provider like a doctor or a nurse or a paramedic staff that basically is in the front line of actual medical service delivery to a patient. If we were to look at these three as, you can say, integral aspects to a healthcare service delivery institution or a business, uh, understanding the role of healthcare. It's like in possibly put in very simple words. If any one of us have to join an organization, the very first document that we all ask is a job description. What is it that my job or role is required to do for this organization? I think in if I were to put it in the same way, uh, developing and understanding the right job description of AI in a healthcare institution is what we are missing today. And I think drafting it out very clearly and making it very clear to each stakeholder that AI is another, what I would say, enabler to patient care. AI is another enabler to productivity, and AI is another enabler or a health or an assistant of sorts, which helps in informed data-backed decision making. I think getting that understanding right amongst these key stakeholders is very, very critical in everyone's context in each of the three roles that I mentioned, be it the chairperson or the owner of the institution, be it the administrative head of the institution, or be it the caregiver or the service delivery provider of the institution per se. That's what we are broadly missing today. I think if the leadership can make an effort to define this very simple job description, that here is are a set of tools, here are a set of solutions that could truly make a difference to productivity, that can truly make a difference to enhanced service delivery, and can actually truly make a perceptible difference to retention of consumers or retention of patients, and making sure that the patients come back to the healthcare system as and when recommended on time. That will truly help in, I think, leveraging AI to the best possible extent. I don't think institutions have professionally approached AI in this way as yet, but I think uh, time is still not lost. We can very well get to that point and I think define that job description, which is understood right and in the right context by each of the roles.
Yeah, I think
Excellent.
like very well picked up on that one. And job description is something which is very important, and definitely with the job description, people need to understand a bit more. So like a bit of training and the efforts from human resource department to help different roles understand how it will benefit them, because ultimately there's a shift. It's a shift in the how organizations operate. And if we are doing a shift in that, as we experienced previously while the computer evolution happened or email evolution happened, so similarly we need to like let people know that this is something which is for their good and not will hamper their day-to-day working, plus at the same time will not threaten their jobs. So like the more they use, the better will be productivity, and they can focus on the more important activities rather than just getting fixed with the BAU activities. So it has
Correct.
to be a phased up approach and a strategic approach where we start working with the BAU activities thereafter getting into the more
Correct.
niche
Correct.
areas. Yes. Yeah.
Correct. And also most important aspect in healthcare is, uh, see, there are many a times we can't afford to miss certain very specific information
Mm.
before we give a prescription or a medical advice. Many a times we see that doctors being extremely busy in their work. Uh, if the pre-workup in terms of looking at the last or the previous medical records or the old medical records of the patient, if it is missed in any way, and if we know that the patient has been on a certain medication previously, and if that information were not to be made available on time, sometimes we see that there are certain drugs which should not be given to patients who are on certain types of current medication, because two drugs do not interact well certain times, and we should avoid certain types of medication in specific medical conditions. So like that, it could be diabetes, it could be cancer. In different conditions we should avoid. Now what AI certainly has the potential to do is to pinpoint potential lapses in information, if any, so that it will truly help in an informed decision making. It is like a computer, if you were to close a document before saving, it would always give you a pop-up that says, don't you want to save this document? So it's like that alert or a pop-up that would typically help someone to take a pause and say, hey, do I have all the information before I really give this prescription out? Have I really looked into it? So I think making the service provider think a bit before that is given out, and thereby eliminating risk or reducing lapses or wrong decisions, if any, will significantly improve quality of healthcare. So I think that is the value that this brings to the table, which needs to be leveraged by every part of the organization.
Quite true.
Right. Right. I think that really puts a lot of light on, how we going to do management in terms of our, you know, treatment delivery. How are we going to evaluate diagnostic deliveries as well when you're doing diagnostic findings, etc. So how are we going to put the previous history of the patient in line to, what are we doing, whatever investigations are happening at this point in time. So I think that was a very good eye opener from your side that the AI needs to have a proper job description in terms of what it's going to do and achieve for us. Putting up, an extension to this question. Of course, these are some clinical, I would say not completely clinical aspects, but somewhere between treatment delivery aspects of the hospital. But how do we see it, in the silo of a marketing campaign? Right? So when we're looking at something where healthcare marketing needs to take place, wherein it might just not be in terms of selling a particular service or a package, but also more from a perspective of do we have certain say health camps that are working, right? There could be certain kind of free services or CSR activity that the hospital is conducting, and then would want participation from all the patients that it has had. So, how do you look at integration of AI into these systems? Maybe through your EMR or maybe through your digital marketing agency or an internal team. So, where do you see the participation of AI in this silo?
Sure. Um, we see the role of AI on two fronts. One, I'll start with the marketing side of it. And the second is actually on the actual diagnostic side of it, which is more if one were to talk about preventive healthcare, and if
Correct.
one were to talk about being more health conscious, yet make the right decision at the right time, right? Now, the first point I wanted to talk about is the marketing part of it. Now, I think it's very critical to understand that like how the old saying says, being at the right place at the right time. I think every marketing campaign should also follow look at saying the right message to the right audience at the right time. I think staying relevant, the context and the content should be relevant and timely, and it should address the right audience. So I'll give you an example. Now, one thing that we need to understand, I think we did bring this up in the Bangalore meeting also.
Correct.
Healthcare service delivery is something that people generally do not consume like the way how they would consume an FMCG product or a service, right?
Yeah.
So healthcare is always seen in the context that only if I have a problem, I will reach out to a healthcare facility. Otherwise,
Correct.
nobody would very joyfully go and see a doctor, very joyfully enter into a hospital to kind of, for entertainment, in other words. So therefore, it's in a very, I would say, different context or a situation that people will try to reach out to a healthcare service provider, a doctor, or step into a hospital. So therefore, understanding that mindset is therefore important to say that we can't market healthcare services the way how we market FMCG products and services. Yeah, it's very, very important. So therefore, what's the right way to market the service? Many people have also told me, I mean, many healthcare marketeers have told me that why don't we create and in our national language, it is like saying that thoda sa if there is a little bit of fright that can be created, that if you don't do this, this could happen. So if you don't screen yourself on time, so you could possibly have this risk and it may take away your life in these many years. So I think creating that fear or fright, or using fright or fear as a way of marketing also is something I suggest
No.
is not really the traditional way that a healthcare marketer should think about. Therefore, what could AI truly make a difference in? I think AI could truly make a difference in helping us to really try and understand and position the context and the content right. And I'll give you a very specific example to it. Um, so, um, there are certain types of cancers which run in families, okay, and it's serious stuff. And what truly makes this happen is that there are specific gene mutations which runs in families which are inherited. Now, not many people might know about it, but the point is, if you were to look at sequential hospital data, and I'll give you a very simple example. So we have a common gene mutation called the BRCA1 and BRCA2 gene mutation, which we see in patients who have breast cancer. Now, it is also seen in patients that have ovarian cancer. Now, in our family, if we were to look around, and if we see that there is someone close to us, it could be within the family lineage, like the grandmother, the mother, the daughter, the cousin. If anyone were to have suffered with a breast cancer, and we know that this type of cancer runs in the families, this data is available with the hospital. Now, this is very valuable insight for a healthcare marketeer who works for that hospital, where all that the marketeer needs to do, he or she needs to look at the data of people or patients that have come to the hospital with that specific condition, and run a very specific targeted communication campaign, a marketing campaign of sorts, to run a breast cancer or an ovarian cancer screening program to only to the kith and kin, the first circle relatives of that particular patient. So it makes it very targeted, it makes it very relevant, and the chances of uh, detecting someone early on within that first circle family network is also very high. So therefore, it makes it extremely relevant to that audience. Now, the same may not be relevant to an audience where they may not have had anyone in the family that might have had a cancer. So to them, it comes as junk. That, okay, what do I do with this information? I don't think it's relevant to me. So I think getting this level of customization or personalization of a healthcare marketing message is what healthcare marketing would truly need. And in none of this message you're creating any fear. In none of this message you're creating any, I would say, you're not forcing yourself into getting an investigation done. You're actually making someone think that, okay, this is something I might want to get done for my own benefit. So I think creating that pull factor through timely context and content is where AI can truly help in healthcare marketing without creating the element of fear. So that's one of the experiences I can share, and I'm sure there are multitude of other possibilities that can happen in a similar context. And then the second part of the same answer to the same question is on how can AI be useful on the delivery side. Now, if you look at the delivery side, today we do have very well evolved algorithms, both in health checkups. So we run a program at Apollo called the Apollo Pro Health, and Apollo Pro Health is a AI enabled health checkup program presently targeting non-communicable diseases like high blood pressure, diabetes, and high cholesterol, where when you are able to have when you do the test, and when you also have access to previous sequential data of the same kind, it is able to very clearly tell the risk of heart disease, risk of developing stroke, and what are the preventive measures to be undertaken to reduce the risk in such instances. So it gives a very clear guidance on that. Likewise, we have also developed a proprietary algorithm in cancer, in oncology, which is now being put into use in what we call as Apollo Precision Oncology Clinics, which truly help in understanding the actual behavior and gene mutation in specific cancer patients. And it helps in a very informed decision as to what is the most relevant targeted treatment or a personalized treatment that can be given to this particular cancer patient, which will give possibly the best outcome in that cancer patient. So these are two major applications that we have already implemented at our institution, and there are many more that are possible in the same lines. So therefore, it does have a huge role to play on the delivery side as well.
Right. I think it was great to understand the initiatives that Apollo is putting in place to not only ensure that the complete family is taken care of, whether it's identifying gene mutations in oncology, or whether we're trying to look at pro health at the beginning of the journey, where probably detection is something that everybody fears. treatment comes later, but everybody just fears the first step that if I walk in, I might just be detected with something. So should I walk in or not? That's a fear that everybody has in their heart. So
Correct.
I think the storytelling bit where we were expecting that you would tell us and guide us through an internal story of Apollo. I think you've already done that in and in a very beautiful way that gives us an enlightenment on how these things actually affect us. And this is something that even I never thought of, that okay, if somebody else has cancer in my family, then maybe I would also be uh, probably looking up to something like that and get myself tested.
Yes.
So then that was like a very big eye opener for me, right, in this moment. And I think so was it
Yes.
for us. We both were listening very diligently to Karthik in terms of how this works out and pans out. But just moving to the next bit of our storytelling session. So, how do you see, of course, we've spoken about the diagnostic part, the treatment delivery part, but then when outcomes are coming to, what outcomes are we looking at in terms of enhancing this patient engagement? So, when the patient is getting engaged, say, you have a pro oncology platform, like you mentioned, and then the patient is actually coming into the system. We are, engaging with them, and then there are certain outcomes that are that we're expecting from it. So it could be maybe they sign up with us for a package, they sign up with us for a treatment or a service, and then further they come into our operational cycle where there are follow-ups happening, there are sittings happening, maybe there are LASIK treatments or radiology treatments happening, etc., right? So when we are putting the patient through this particular journey with us, once they have onboarded with us, where do you see AI can be significantly implemented to enhance their whole experience? So right now we've spoken about how do we onboard them, how do we put in the marketing effort, but what happens once they are onboarded, right? So how does that journey look for us?
Yes, I think once they are onboarded, AI has a role to truly play the role of what do I say, best pal, more of a virtual assistant, a healthcare assistant, if
Correct.
used properly, if used wisely, right?
Hmm.
Now, the role that we see at the moment, I can tell you, we'll be launching two new programs.
Hmm.
One is a program that we have recently launched. It's called it's actually one of the best practices that we learned from a leading cancer institution in France called Gustave Roussy. And from Gustave Roussy, we took this good practice in terms of enhancing breast cancer diagnosis early on, and we've presently launched what is called as the world's fastest and most precise breast cancer diagnosis program. We call it as FAMP, as an abbreviation. What happens in this is, a woman, typically, we always recommend that women after the age of 30 do what is called as the self examination of the breast. And if there is anything that they detect that is suspicious, you would always advise them to do a screening. And we have launched a very cost effective option, which is affordable by most women across emerging markets, where the depending on the age group of the patient, we actually do an ultrasound or a mammography followed by a biopsy with a full reporting within 24 hours. And this gives the fastest diagnosis to know whether the woman has a breast cancer or she doesn't. Likewise, next month we are actually launching the world's fastest lung cancer diagnosis program, which is based on high resolution CT or computer tomography, as we call. And in the past, as you know, we did have during the COVID times, I did mention this in our Bangalore meeting as well. It was very, very relevant to have an accurate diagnosis looking at a lung CT or a chest CT, as we call, to differentiate between what was a COVID pneumonia versus what is a non COVID pneumonia, so that accordingly the right treatment could be instituted. So, same way, in the high resolution CT of the lung, using artificial intelligence or AI algorithms, we are now able to differentiate whether it is truly a lung cancer or it is something else which is not a cancer, some other lesion in the lung. So, those applications we are already introducing. The breast is already there, the COVID infection one is already there. The lung cancer one is going to come very soon in about a month or so. So, we are seeing that one, it is increasing diagnosis, and it is increasing diagnosis for in people that volunteer to get this done. Second, Once diagnosed, you did ask me a question, what are the other use cases or applications that we see? What we truly see is that a patient can make sure that their common questions that they have, so for example, sometimes they have a common question: should I take this medicine before food or after food? Two, if I skip this medicine, should I take two tablets all at once? Three, if I have skipped my injection, can I take it the immediate next day? Can I take it after 2 days or after 1 month? So what is it that I should do if I'm not able to stick to the correct compliance or the regimen what was prescribed to me? So these are common questions that keep going on in the mind of patients, and many a times, doctors or rather patients find it difficult to reach very busy doctors to ask some of these common questions. Now, all of these are now solvable with AI because this is common medical knowledge where the experts can pre feed the right advice for these common questions meant for patients. And we are now encouraging patients to download our Apollo 24/7 app. The app does have, options and you can say questions that you can ask, and it is attended by a chatbot. And then the common questions can very well be answered through the information that's already pre-fed by the expert medical consultant. And
Hmm.
then if it is an emergency, the app also enables an emergency consultation request through a virtual consult or a video conference based consult with the expert consultant as well. So that way, the patient can now have, literally instant access to the relevant medical information for questions that they have. And that can truly enhance, you can say, informed patient care, and it can truly enhance, I would say, overall patient outcome in healthcare service delivery.
Right. I think that was very rightly mentioned by you that, sometimes the questions are uh, repetitive from the perspective of the specialist or the doctor who is in touch with the patient and giving the special care. But at the same time, these questions are very, I would say, the patient's very fearful while taking decisions around these medications because you never know what could be the side effect, and we being a non-medical professional, we would not understand the implications coming in by delaying the medication or not taking it on time. So I think that kind of guidance is, very very necessary when
Something
it
very
comes.
important. One more thing on this one. So it's also very important that the information which is in past is actually coming from the house where the expertise lies in, because misinformation is a very big problem, and people are
Correct.
suffering a lot from that. Like everything on Google, if you search about anything and everything, the answer is cancer. So it's really a lot, a very like difficult state for mind for the patient when they're trying to find some information. So if something is coming on from the right house, like where the information expertise is there, that's really helpful, and that's where the patient engagement will like enhance, and also they get the right kind of information, right kind of notifications, right kind of suggestions through artificial intelligence.
Hmm.
Absolutely.
Right, right, Arsh. Arsh, in your expert opinion, what do you think are the challenges that come in when we're trying to integrate these kind of tools, with healthcare establishments, say like an Apollo or someone who's on that line, where the operations are humongous in nature, we're dealing with lakhs of patients every day. So, what could be some implementation related challenges when we're implementing, say, a conversational AI virtual assistant, or we're trying to have, any new technology integrated. So, from a tech hat that you wear, what would be some expert, uh, opinions or tips that you would want to put across?
I'll not say challenges, because when a house is ready or when the companies or business is ready to adopt artificial intelligence, they've made their mind already about it. So I'll not say like challenges in terms of implementation, but more so about like how to proceed further in that. Because the expertise of building a strategy around like how to develop and how to take it forward, that is
Hmm.
something on which the organization can be helped on. Plus at the same time, like how to like ensure that the implementation is successful and is being like people who are involved in that are being trained enough so that they adopt, and they're getting to the right kind of benefits. So definitely like coming from that background of technical expertise, we can help in strategizing, looking at the future for a sustainable operation, sustainable implementation, and also looking at like how technology should be understood. Because these are very different domains. Healthcare is a very vast domain, and a lot of people work in it. But like how technology should be adopted, that is something which the technology houses come into and help on.
Right, right. So, Arsh, this is something that comes from the side of the vendor. Like, when you're trying to develop something for a hospital, these are, as a product company or a service organization, these are the challenges that we might face. But then let me pass the same question to Karthik and understand from him that, what are the challenges that the establishment faces, right? So, maybe there are a lot of tools and softwares available internally. There is an EMR in place, there is an HIMS in place. We're trying to integrate other technologies, say probably like a virtual assistant. There could be other automations in place that could come in. So, how do you look at it? When you have these bunch of services and products coming in together, do you face any challenges, or would it be more interesting? Wouldn't it be more interesting to have all these services under a single platform where AI is actually managing it all for you, and then you don't have to deal with various products and services. You can have a single virtual assistant, say for an admin support. You could have a single virtual assistant for a paramedical support. You could have a single virtual assistant for your operational support, etc. So isn't that a better solution? And do you think that's the future?
No, I completely agree. I think an integrated system and having a single solution to address the needs of both internal and external stakeholders, including patients, is always desirable. But unfortunately, I don't think we are there yet. I'm not sure if any other healthcare organization has reached that level of maturity yet.
Hmm.
Our day-to-day challenge, what we face is we have a traditional system that runs the EHR or the EMR within the hospital. The patient database are lying on a certain legacy system. Now now we introduce this AI, you can say, customer facing solution. Now, to make this front ending customer waiting solution to seamlessly send data points back into the legacy system has always been a challenge, and we are in the process of getting that, you can say, resolved. So
Hmm.
presently as we speak, the AI solution and the customer facing this data points sit on a in a separate system. The traditional EMR sits on a separate system, and they don't talk to each other. Now, for me to be able to make an insightful decision, and for me to be able to see sequential medical information of a certain patient, I will need to link it to the patient's unique health ID. Now, the same patient's unique health ID exists on my legacy system. The same patient's unique health ID exists on my patient facing AI system as well. But getting to map the same ID and then get into sequential insighting today is still you can say, a difficult task. It's not a seamless task. So, therefore, getting that is very critical and important. And naturally, as an organization, when leadership makes a decision to embrace these kind of tech, it's also important that before that decision is made, the legacy system should also be upgraded to make sure that it is compatible with what we are introducing on the front end.
Correct.
Because many a times I have seen this myself, that a lot of these tech is launched with so much of pomp and show, so much of PR and media activity, but it falls flat on the face when you actually get a consumer, and my consumer is scanning an app in my pharmacy or in my front store at the time of you know admission to a hospital, and it doesn't work, and that's poor consumer experience. And then you call the IT guy, the IT guy comes and gives some solution. I think we should get out of all that. So gone are the days where you need to really get those kind of manual human support. So now I think it should really work seamlessly until once we have truly thought about making sure that the back end is ready to receive the front end. So that is very, very critical from a timing standpoint. Getting that right is important. That's the constant challenge that we have as a healthcare service provider today, which we are solving.
Yeah, that's
Right.
quite true because the legacy systems which are there and they are like typically built on older technologies, and with the newer technologies, like the compatibility issues happen sometimes, the version issues happen sometimes. We have to
Correct.
really like upgrade the legacy systems as well. So we have to look at both ends while we are doing a
Correct.
transformation.
And the most important issue is to solve the issue of duplicates.
Hmm.
Now, the same patient is coming back to the hospital another time. People are still finding it difficult to find the UHID of the patient when the patient came to the hospital the first time. So my question back to them is, why don't you just integrate with Aadhaar? So Aadhaar has biometrics. Just integrate the biometrics. The patient's uh, fingerprint wouldn't change. The patient's iris scan wouldn't change. Just scan the iris, scan the what do you say, the fingerprint, the thumbprint, and you should have all records, including the very first unique health ID that you created. I think it sounds very easy, but I don't know. It's not yet implemented with such in a seamless way. So it's
Correct.
very complicated to find where is this patient's UHID the very first time the patient came. Again, some IT guy will come and he will take half an hour, 1 hour to solve the issue. I think we should really get out of all those legacy things. It should be really seamless. Healthcare is getting there, but not yet there. I think it will take a little while to get to that level of seamless work.
Mhm.
Definitely, I'll give you an example of a Nepal hospital. Not taking names here, but they have a similar system where they're taking identification based understanding of the patient data, and then they are, but the systems are still not integrated, but they are moving in that direction. So we've got a chatbot implemented there, and now the next level of the discussions is about doing that integration so that we can identify, because you were right, it's very easy with like the right kind of identification we can very seamlessly identify, and then it's a whole lot easier because if you're using a single identifier for each and every aspect, then it's very easy to identify each and every patient journey and how they it should be related to different other aspects as well.
Correct. Correct.
Yeah.
Even a face
Correct.
scan. A face scan is good enough.
Yeah.
Because see, today airports have made it seamless. So when
Yep.
airports have made it seamless, why can't a hospital? It's easy. It's implementable.
Right, right. So when we're talking about so much of seamless patient journey that might start with just giving access to the face record or say giving access to the fingerprint, etc. But with this, don't you think there would be a lot of data implications that would also come, and it becomes like a very imperative part of our responsibility to ensure that this data is being handled well, is being maintained with all sanity, is being utilized with right permissions and disclaimers. If the data is being flushed to say a clinical research, are we taking the right permissions? Are we entitled to share that information in the first place? So, what's the take, on this? And this is a very crucial question. That's why I held it up for the last bit of our conversation because everything said and done, everything is we fancy modern stuff, we fancy technologically high tech stuff, but then where is it headed? Right? Is it
Yeah.
safe? So what's an answer to that?
I think it's a very important topic. Glad that we're discussing it. Data privacy, especially in healthcare, is even more critical and important because a health record is possibly someone's. It's extremely personal to the individual, right? And therefore we need to respect that privacy for sure. What I was referring to in the previous instance is enabling seamless access to more like an entry and more like an access to access healthcare rather, or access a hospital, access a doctor.
Hmm.
So access is what can be enabled seamlessly. I don't think by having a face scan in the airport, my security is compromised in any way. It's rather better because I know that I entered through this particular terminal, through this particular way, and there is a record available of entry and exit. So it's the same as the record that we make on passports in immigration as well. But I
Correct.
think when it comes to the next step, learning something from banking truly will help us solve the privacy issue and rather give us an instant solution. So in banking, even though you can open your account or a bank account through your face scan, through your you can say your retinal scan, or even through your fingerprint. it will still ask you to authenticate via an OTP, which is sent to your through an SMS. It is and it's sent through an email for every single transaction, however big or small the transaction is. And then only when you authenticate that is when it gives you access to the bank account. Okay. So likewise, even though you've entered your email ID, your mobile number, everything is correct, every transaction still needs to have an authentication from a unique OTP that is generated. So likewise, once the access is provided, if we can make sure that there is a two-level security, that is authentication, that is built for accessing personal medical records and sequential medical records, and that can very well be done the same way how banking is done today. I think it will help one, keep the data secure, maintain the privacy, but again make the access to private data seamless as well. So that's what I feel can easily be done to solve this, and healthcare organization can very well learn or take this as a good learning from the banking sector.
Yeah,
Right.
so
First,
yeah, sorry, I just wanted to add one point over here. So in terms of like the front end, Karthik already suggested like what needs to be done, but we also need to be very careful about the back end aspects, wherein like we have to understand the scale of data, the security of the data which is being put into the systems. So we have to be very careful about that. And how do we ensure the patient's data is secure enough in the backend so that it's not compromised? We are not like just getting it out in any way, or maybe like there are multiple attacks, cyber attacks happen on databases, servers, etc. So how do we ensure cyber security? And this is very important concept which is coming up as well: cyber security with artificial intelligence. That is a very novel concept, and it's like it's getting pushed in the right direction, in the right way, and it's very fast paced. This particular technology will help us also secure a lot of like backend aspects, wherein like we'll be able to solve the data breaches. And that is very important because when a data breach happens, it's like to the tunes of millions of records, and that's very like scary as well. So yeah, we need to be very careful on that end as well. Yeah.
right.
Absolutely. Absolutely, and I don't know if tech-wise, if it is possible that a two-level authentication may be required. It's not just that someone in the hospital,
Mhm.
is able to access the EMR or the personal health record of a patient
Mm.
without the patient's authorization. So, if a two-level
Yes.
security can be built, where without the consent of the patient and a patient not entering like a key or a password, if the data can be protected, then I think it builds a lot of trust that way, where the patient will then truly have belief that without my personal authentication, nobody can access my data.
Mm.
So yeah, I think building that kind of a security system will truly help.
Definitely.
Right, right. I think we have discussed something that is really not in a far future, but something that we might start seeing in the near future as well. Especially the bit that you mentioned about two-factor authentication, the bit that Arsh mentioned, that there are breaches that happen in terms of data, and then AI along with cybersecurity is like a arrow that's moving in the right direction. So, combining all this, I think we've had a very elaborative discussion on maybe challenges, understanding stories from your side, Karthik, of how integrations happen. Uh, Maybe when it comes to oncology or any pro, you would say, camps that you're running at Apollo. So it was great understanding all of this. And like always, Karthik, it's really enlightening to speak with you and understand different perspectives. You really make me think. So I'm really evaluating that enroll for the Apollo package. So it's really made me think and light that fire in me. So, and I think that would be the effect on all our listeners and viewers as well. So thank you so much for coming on board and help us discuss such sensitive topics, because these questions do come up to our mind, but there are no right professional uh, medicos or people sitting in the management like you who answer these queries for us. So it's very essential that we get to learn from your end as well, that what are these healthcare establishments that we look up to, what are their future strategies for us as a healthcare say a patient who's walking up to these healthcare establishments. So thank you so much for putting up light on that. Arsh, thank you so much for your knowledge based on everything that comes along with AI. So I think the healthcare expertise of Karthik and the AI expertise of Arsh definitely made this conversation very, very interesting. Thank you both of you for attending this and taking out time. Lovely speaking with you, and hopefully we'll have another session of this discussion once again. Thank you so much for attending, and thank
Thank
you,
you.
viewers.
Thank you, Sneha. Thank you, Karthik.
Thank you, Arsh. Thanks, Neha. Thanks, viewers. Always a pleasure.